Hi, my name is Grant Duncan. I'm the Clinical Training Manager with Haag-Streit UK and John Weiss. Thanks for asking me to join your meeting. Today I'd like to present to you on the Eyesi Medical Simulator range. My presentation will cover the following topics. We'll start with a short video describing each of the medical simulators in the ophthalmic range: the Eyesi Surgical, the Eyesi Direct and Indirect ophthalmoscopes, and the newest member of the Eyesi family, the Slit Lamp simulator. I'll then focus on the features of the Eyesi Slit Lamp simulator, including the virtual patient database, the embedded courseware, the findings library, and the educator feedback and assessment function. I'll then introduce VRMNet, Eyesi's online learning facility, also available with the surgical simulator, followed by a virtual demonstration of the Slit Lamp simulator. The Eyesi simulator range is already well established, with more than 30 surgical simulators in the UK. Since April of 2020, VRMagic, the creator of the Eyesi simulator, has been part of the Haag-Streit group of companies, and at the end of March this year, VRMagic rebranded as Haag-Streit Simulation. Let's take a few minutes to watch a series of short videos describing each of the Eyesi medical simulators.
Eyesi Surgical is a high-end virtual reality simulator for intraocular surgery training. Original instrument handpieces are inserted into the simulator's model eye. Looking through an OR microscope, trainees experience their interaction with tissue and intraocular structures simulated in real time. The pre-installed Eyesi courseware offers training at different levels of difficulty, from basic skills training through to surgical procedures and complications management. For cataract surgery training, instruments such as forceps, viscocannula, cystotome, and phacoprobe are available. The simulator provides an OR machine interface and instrument foot pedal to control fluidics. For training of posterior segment surgery, Eyesi is equipped with a vitreoretinal interface. The integrated biome mimic functions just like a real biome in the operating room. Trainees must select appropriate OR machine parameters in order to safely and effectively complete a surgical procedure. During virtual surgery, instruments such as light probe, cannula, endolaser, and vitractor are available. At the end of each task, Eyesi provides detailed assessment of the surgical performance.
Eyesi Direct is handled exactly the same way as its real counterpart. Looking through the ocular, students can examine virtual patients of varying age and ethnicity. Diopter settings and light intensity can be adjusted through controls on the Ophthalmoscope handpiece. After each virtual eye exam, trainees receive detailed feedback.
Eyesi Indirect is an augmented reality simulator for training of indirect ophthalmoscopy. Through the simulator's head-mounted display representing the ophthalmoscope hat, trainees see a three-dimensional virtual patient and their hand holding the virtual lens rendered into their view. The simulator provides a broad and standardized clinical experience before students examine their first real patient. The embedded curriculum ranges from basic skills training through to therapeutic decisions in complicated clinical cases. At the end of each examination, the trainee is presented with a detailed evaluation of both procedural and diagnostic skills. Eyesi Slit Lamp is a new virtual reality simulator from VRMNet for training of eye examinations. The slit lamp is a key tool in detecting eye diseases. VRMNet integrated their VR technology into the original hardware of a Haag-Streit slit lamp model BQ900. The Eyesi Slit Lamp training simulator offers all functions of a real slit lamp, such as setting the slit width and the angle between the stereo microscope and illumination or setting filters. With Eyesi Slit Lamp, students can examine a wide range of clinically relevant cases before they meet their first real patient. The simulated patient eyes are based on real patient histories and were developed in cooperation with universities and eye specialists.
To provide an in-depth look at the functionality of Eyesi simulators, I'd like to single out our latest innovation, the Eyesi Slit Lamp simulator. The slit lamp is almost certainly the most ubiquitous of instruments used on a daily basis by ophthalmologists, optometrists, and a host of other allied healthcare professionals. I'm sure you're familiar with this, and many of you may already use a Haag-Streit slit lamp, perhaps the BQ900 pictured here. The slit lamp is a diagnostic instrument consisting of two key components. A high-intensity light source, the illumination system, that can be focused to shine a thin sheet of light into the eye. This is used in conjunction with a biomicroscope, the observation system, to examine both the front and back segments of the eye. The slit lamp allows a detailed and magnified view of the eyelid, sclera, iris, lens, cornea, and vitreous, and the retina can also be examined using an indirect handheld lens. I've spent a lot of my time training people in slit lamp and slit lamp imaging skills, and during that time, I've come to appreciate that what people want and need is as much hands-on time as possible. Here's a word cloud generated by analysing all the feedback we received for face-to-face training from 2018 to 2019, and as you can see, it speaks for itself. But hands-on practice isn't always possible. Time is limited during busy clinics, and it's not always convenient to learn on real patients, and during a pandemic, I'm guessing it's now on impossible. Of course, practicing on colleagues is useful, and it's an approach that we have utilised during our live training courses, with attendees taking turns to examine each other. But it's unlikely that trainees will be exposed to a wide range of disease using this method. And of course, fundoscopy is difficult to train at the best of times, requiring as it does boundless patience on the part of both teacher and student, not to mention the subject with their requisite dilated pupil. That's why the Eyesi Slit Lamp Simulator is such an exciting development, providing an incredibly versatile training environment to learn the skills needed for all types of slit lamp examination. The Eyesi simulator offers a familiar and lifelike training experience as it's based on the Haag-Streit BQ900 slit lamp, one of our most popular models. The simulation of the eye and its anatomical structures has to be seen to be believed and is almost indistinguishable from the real thing. The behaviour of the simulation is incredibly lifelike, right down to the way the pupil reacts and the eye blinks when the illumination intensity increases. And the system features a wide variety of virtual patients with different genders, ages, and ethnicities. The range of pathology in clinical cases covers all areas from the lids and lashes through the anterior segment into the posterior eye and onto the retina using the new Fundoscopy functionality. Eyesi simulators are equipped with comprehensive embedded tiered curricula structured to take trainees from novice to experienced slit lamp operator. The onboard training software also provides comprehensive feedback and performance evaluation. The Eyesi Slit Lamp Simulator comes with a full range of functions and controls, from setting the angle between the stereo microscope arm and the subject, to adjusting the slit width and height and controlling illumination levels, magnification settings from 6.3 to ×40, and deploying the standard set of filters available on the Haag-Streit Slit Lamp range. You can perform a full range of examinations, from the front of the eye to the retina, and later this year, you'll be able to examine the anterior chamber angle with a gonioscopy lens and module. The Virtual Patient Database. As well as training users control the device, each Eyesi simulator utilises a case-based approach to teach diagnostic skills, something that's difficult to teach in a busy clinic setting or practicing on colleagues. Each case includes clear objectives and detailed patient information. The Eyesi Slit Lamp simulator includes more than 150 onboard cases, covering a wide range of different training scenarios, featuring highly realistic, clinically relevant pathologies and lesions. Embedded courseware. The structured, tiered curriculum has thousands of hours of development behind it, with contributions from clinical and industry key opinion leaders. Learners work their way through courseware that gradually increases in difficulty and can only advance once skills have been consistently demonstrated, with multiple choice questions augmenting the practical skills. And although learners can work independently, forging their own path through the courseware case by case, the system administrators and educators can track students' progress, locking or unlocking access to the different courses as required. The first tier of content deals with slit lamp operation and illumination techniques. Tier A of the Eyesi Slit Lamp curriculum consists of simple, abstract tasks for practicing device handling and illumination techniques. Visual cues provide step-by-step guidance, helping trainees explore the operation, function and effect of slit lamp controls. Tasks in Tier A include finding and focusing on different symbols to confirm factors such as focus, magnification and illumination angles. Tier B introduces the simulated healthy eye, focusing on the visualization and examination of normal, healthy structures. This tier also introduces the concept of normal variations, including different iris pigmentations, unusual appearances such as arcus senilis, different retina pigmentation, and anterior chamber angles and structures. The third tier is focused on training established grading and classification schemes. In Tier C, trainees begin to practice the detailed assessment of diagnostic findings. For this purpose, more than 50 virtual patients are available, presenting with pathologies of the anterior segment, including anterior uveitis, trachoma and cataract, the posterior segment with AMD, the optic disc and diabetes, and Van Herrick's method for grading the anterior chamber angle. When you begin your training, the findings menu is initially empty. This means that you have to collect findings one by actually seeing them in a virtual examination. These include a brief description of what you have found, including medical background information. This way, you build up your personal findings library during the training, which allows trainees to undertake a self-reliant recap of learning content. For training of more complex examinations and diagnosing more complex disease, the fourth tier of the Eyesi Slit Lamp embedded curriculum provides around 100 virtual patients. These cases have been developed in close cooperation with university eye clinics and include complete case histories. You can use all available slit lamp modalities to detect and show appropriate case findings. So, for example, in a case of proliferative diabetic retinopathy, you will have findings in both the posterior segment, such as exudates, hemorrhages and neovascularization, and in the anterior segment, such as iridopathy. Feedback and assessment. The Eyesi Slit Lamp simulator offers guidance, feedback and assessment to support trainees in their learning process. The system allows for a detailed evaluation of both device operation and diagnosis, and competency-based assessment fosters trainees' confidence and provides a significant reference for educators and administrators. The Eyesi Slit Lamp simulator offers guidance, feedback and assessment to support trainees in their learning process. The system allows for a detailed evaluation of both device operation and diagnosis, and competency-based assessment fosters trainees' confidence and provides a significant reference for educators and administrators. At the end of each virtual examination, learners are presented with a detailed evaluation of their examination and diagnostic performance. Scored parameters include the examination time, the light exposure, the completeness of findings, and accuracy of the diagnosis. This immediate and objective feedback allows trainees to improve their skills systematically and helps to keep them motivated. All training data is stored in the simulator's database, and using VRMNet, both trainees and educators can access an individual's training status for further review or discussion. VRMNet is a web-based training portal that can be used to network and link multiple simulators. The VRMNet service can be accessed from any computer or mobile device. The portal offers students access to online system orientation, medical courses, and extensive and detailed individual training data. They can also access their own personal findings library using VRMNet. Medical online courses available on VRMNet link to and extend the practical training gained with the Eyesi Slit Lamp simulator. Didactically structured background information is enriched with videos, images, and multiple choice tests. In some cases, trainees may need to complete online medical courses before progressing with certain practical simulator-based tasks. Educators and administrators can use VRMNet to quickly and easily set up user accounts. The system allows the management of courses and content from any computer or mobile device, and the secure VRMNet database allows educators to monitor and review their trainees' progress. VRMNet offers a host of different benefits, but three key advantages of the system are data synchronization among network devices, which optimizes content and device allocation and allows trainees to continue to progress their training on any available network device. The entire system is cloud-based, hosted on secure servers, ensuring ease of operation and the continual backup of training data. And automated software updates, whereby all network simulators with a VRMNet license receive the very latest system software, benefiting from new, highly realistic cases and functionality. I'd now like to spend a little bit of time running through a basic demonstration of how to use the Eyesi Slit Lamp simulator. Before logging in, or logging out for that matter, it's important to check that the system has been synchronized. A green icon here means that all data is up to date. Red means that the last synchronization attempt failed, and grey signifies that a data synchronization is in progress, so you should wait until it completes before logging in. Next, enter your username and password. The Courses tab should be highlighted. Next, select the task you are ready to undertake from the Courses section, which is divided into tiers as previously described. Then, select the desired case from the Case section. The first step is to establish the objectives of any given task. You should be in the Patient History tab to do this. In purely task-based cases, only the objectives are displayed. But in patient-based cases, additional detailed patient information and history is also visible. When you are ready to begin the task, select the Examination Targets tab. The current task is then highlighted here. It's important that you read the detailed instructions before proceeding. In order to successfully acquire the target and complete the case, learners must implement all the required settings. Start by adjusting the basic settings, the ones you can set without necessarily looking through the microscope. Some settings may already be in place, depending on how the previous user left the system set up. A green surround signifies a correct setting, a red one needs adjusting, and if a particular setting is not required, it will be greyed out. Now, adjust the slit centration, height, and orientation. In this case, orientation of the slit was already set. As each desired setting is achieved, the relevant box turns green. Continue with the other settings. Filter and illumination intensity, illumination and microscope column angles, slit width, magnification settings, and background fill illumination level. It's worth noting that some of these basic settings may drift back into red once you start the examination proper. However, once they have been achieved, you can switch to the live view. This recreates the view the examiner sees through the oculars of the microscope on the touch screen. The operator will find a host of additional controls on this screen. Setting the patient's direction of gaze to improve the view of a particular part of the eye. Enabling or disabling the slit diffuser, adding fluorescein, keeping the virtual patient's eye closed, making the eye blink or stop it from blinking, everting the eyelids, fixing the patient's gaze, or dilating the pupil. Users can capture screenshots of the live view to save to their library. These are temporarily stored in the Messages tab. You can also switch between oculars for the live view. For the examination of the virtual patient, the operator switches back to the Examination Targets tab and looks through the oculars, making final adjustments in order to acquire the desired target. When this is done, the final required setting box will turn green and the system delivers audio confirmation.
Initial setup correct.
As well as the audio, the system also provides visual confirmation that a task has been completed with a green tick in the box. The ability to select the next target is then revealed and the trainee can move on with this particular case. Notice that the required settings are nullified and may change to reflect the nature of the next target. A recent exciting addition to the Eyesi Slit Lamp simulator is Fundoscopy. Tiers C and D introduce different tasks for retinal examination and diagnosis, including grading and classification of certain conditions. The Fundoscopy functionality was introduced earlier this year with the addition of the simulated patient head and fundoscopy lens. The introduction of the simulated head allows for physical ability to avert both the lower and upper eyelids. The fundoscopy examination has the same interface as the anterior cases with required settings and a live view. This provides an incredibly realistic simulation of the fundoscopy exam using an auxiliary handheld lens. Again, there is an audio confirmation when the target is acquired. I hope this presentation has given you a taste of just how remarkable the Eyesi simulator range and the slit lamp simulator in particular really are. Just to recap some of the key points. The wide range of Eyesi simulators offer extensive risk-free training for a host of medical and surgical skills without the need for a willing but nervous patient or altruistic colleague. The lifelike nature of Eyesi simulators really does have to be seen to be believed, and the extensive database of cases, as well as the ability for learners to store and return to their findings, make it a truly effective learning experience. The embedded courseware with thousands of hours of development behind it and contributions from hospitals and universities is of an incredibly high standard, and the comprehensive feedback and assessment allows students, educators and administrators to track and support individual student progress. This embedded simulator content is augmented by additional online medical content via the VRMNet portal, and a fully networked solution allows learners to continue their progress on any linked simulator, PC, or mobile device. I'd like to leave you with a final word, and that word is gamification. The application of typical elements of game playing such as point scoring, competition with others, rules of play, etc., coupled with the addictive nature of the simulated tasks, will motivate learners to try and do better than their peers, attain the next level, and achieve greatness, which in the world of ophthalmology can only be a good thing. Thank you so much for giving me the opportunity to present to you today, and I'd be happy to take any questions you may have, via email, of course. Thanks again.